So about classification of orbital tumors. Orbital tumors, if you consider this as the eye, this as the optic nerve, these are the bony, this is the bony orbit. So now this is the proper eye. So if you see from the retina, the tumors arising or retinoblastoma and melanoma, and from the lacrimal gland it can be pleomorphic adenoma and carcinoma of the lacrimal sac. From the bony it can be dermoid cyst, epidermoid cyst and osteomas. From the lymphoid tissue it can be lymphomas. From the paranasal sinuses and nasopharynx it can be carcinomas. From the connective tissue surrounding it can be rhabdomyosarcoma. From the nerves, that is the optic nerve glioma and schwannoma. From the nerve sheath it is meningioma. And mets from the adults, it can be from the breast, from the bronchial carcinoma. In children it can be neuroblastoma, Ewing sarcoma and leukemia. Now I'll be just talking mostly about the retinoblastoma. The key points that you need to remember about the retinoblastoma. Retinoblastoma is the most common intraocular eye tumor. It is seen in ages less than 3 years. It is related to the RB1 gene protein, the cells which lose the protein function of RB1 gene. It is heritable and non-heritable types. According to Knudsen's two-hit hypothesis, it is based on somatic and germline mutation, where both the germline and somatic mutation are required for heritable retinoblastomas, and both are somatic mutations in cases of non-heritable retinoblastomas. The clinical feature that you have to remember is leukocoria, which is the white pupillary reflex, and there is also the trilateral retinoblastoma, which is the feature of bilateral retinoblastoma and pineoblastoma. And in pathology you will see Flexner Wintersteiner rosettes, which is also called as spoke and wheel clusters. The staging is based on Rees, Ellsworth and ICRB, that is International Classification of Retinoblastoma. Rees Ellsworth stages it from 1 to 5 and ICRB stages it from A to E. Management is basically surgery, that is enucleation. It can be photocoagulation in cases where the tumor is less than 3 mm, where a green laser of wavelength of 532 nanometer is used. Also thermotherapy can be used in those cases where 45 to 60 degrees Celsius using infrared irradiation is used. And cryotherapy where minus 80 degrees Celsius for temperature is used using the cryothrow, where 3 cycles of alternate freezing and thawing is done. EBRT, the dose is 42 to 50 gray. You can give whole eye, lens sparing or oblique lateral. It can be like this. It is the whole eye in the sense, here in this sense it is a bilateral retinoblastoma, so laterally opposed, horizontally opposed whole eye EBRT. This is anteriorly lens sparing RT EBRT, and this is oblique at a 40 degree angle for unilateral retinoblastoma, oblique lateral field. Apart from that, plague brachytherapy using iodine 125, gold and ruthenium can be done. Chemotherapy regimens that is used as vincristine, carboplatin and etoposide, that is VCE.